C. Chemotherapy. Who has recommended following drug regimen for 2 years? Dazone 100 mg daily. Rifampicin 600 mg once a month. Clofazimine 300 mg once a month. D. Chemoprophylaxis. Dazone in a dose of 1 to 4 bWv gave protection among child contacts ranging between 35 to 53%. A. Rehabilitation therapy is initiated for restoration of all treated case physically, mentally and socially. F. Health education on the need of regular treatment, protection of children, family planning. Sexually transmitted diseases. A. Syphilis. Syphilis is a chronic infection caused by Treponema pallidum. Mode of transmission. It is an infection of man and hence, man is the only source of infection. A. By direct sexual contact. Though transmitted through the placenta of an infected mother to its fetus. 3. Children contract the disease using infected fomites or kissing by infected adults. Symptoms. Syphilis can be described in 3 stages. I. Primary. Primary lesion called chancre develops on the external genitalia or the anal canal but can be found anywhere. E. Secondary syphilis. It is characterized by appearance of non-pruritic red or pink macules. Red popular lesions, necrotic lesions. Lesions are widespread and may involve palms, soles, face and scalp. Patient feels malaise, headache, sore throat and low irregular fever. There are 4 cardinal signs of the stage: cutaneous rash, condyloma, mucus patches and lymphadenopathy. E. Tertiary syphilis. Lesions appear almost anywhere but particularly in the skin, subcutaneous tissue, bone, tongue, testes, liver, aorta and central nervous system. The affected tissue is infiltrated with granulation tissue. Prevention and control. A. Avoiding extramarital sex and prostitutes. Though using condoms to avoid spreading of disease. 3. Treatment with penicillin, drug of choice. Erythromycin, cephalexin, norfloxacin. 4. Providing health education about sexually transmitted diseases and its problems. Though gonorrhea. Gonorrhea is the infection of the mucous membrane of the genito-urinary tract with gram-negative bacteria, Neisseria gonorrhea. Mode of transmission. 1. It is transmitted by sexual contact. Though infected mother transmit the disease to its fetus through placenta. 3. Blood transfusion. 4. Infected needle, injections etc. Symptoms. Infections of genital organs, urinary organs, rectum, eye, enlargement of lymph nodes of groin. Ulcer of the genitalia. The patient complains of dysuria, increased frequency of makchu, ischion, yellowish-white discharge from urethra, cervicitis. Incubation period. 3 to 10 days. Prevention and control. A. By avoiding unhealthy sexual contacts. Though using of condoms by male partner. 3. Infected females should not conceive until fully recovered from the disease. 4. Treatment by drugs like benzathine, penicillin, cephalexin, norfloxacin etc. 5. Providing health education about STD and its problems. 3. AIDS, acquired immunodeficiency syndrome. It is caused by the infection due to human immunodeficiency virus, HIV, retrovirus. The virus affects adversely the immune system of the body, mainly T lymphocytes. As a result, individual is exposed to numerous life-threatening infections, neurological disorders and malignancies. Mode of transmission. 1. It is transmitted by vaginal, oral or anal sex. Though transmission through blood transfusion, using infected needles of injection, equipments, razors etc. 3. Placental transmission, from infected mother to the fetus through placenta. Incubation period about 10 years. Prevention and control. A. By using condoms. Though by keeping sexual contact with one partner. 3. Avoiding sex with multiple partners who may be in the high-risk group. 4. All blood and blood products should be screened for AIDS before transfusion. 5. Using only disposable sterilized needles and syringes. 6. Screening of blood donors. 7. Using drugs like zidovudine, zalcitabine and DDL, but none is very effective. Art. By providing health education. Non-communicable diseases. Non-communicable diseases are those diseases A. Which cannot be communicated from one person to the other. B. They are caused due to multiple causes and therefore their prevention involves multiple interventions. C. They have long latent period. D. They have an indefinite host. Examples of non-communicable diseases include cancer, diabetes, blindness, cardiovascular, renal, nervous, mental, some respiratory diseases, musculoskeletal diseases, various other metabolic and degenerative diseases and chronic results of communicable diseases. 8. Cancer. Cancer is an abnormal and purposeless multiplication of cells and tissues. It can invade distant tissues or even distant organs and results in death of the patient if it grows beyond that stage when it can be removed successfully. Cancers are generally classified into two types: A. Solid tumors. B. Leukemia or lymphoma. Causes of cancer. 1. Smoking, chewing of tobacco and betel are the common causes of cancer of mouth, tongue, larynx, pharynx, stomach, pancreas and kidney. Though consumption of alcohol leads to higher incidence of cancer of esophagus and stomach. 3. Hot spicy foods produces esophageal cancer. High-fat diet leads to breast cancer, dietary factor 4 intestinal cancer and consumption of smoked fish to stomach cancer. 4. Long-term exposure to various chemical agents like aniline dyes, benzidine, asbestos, nickel, cadmium, chromium, vinyl chloride, arsenic, polycyclic hydrocarbons causes cancer of lungs and skin. 5. Many viruses are responsible for causing cancer. For example, hepatitis B virus can cause cancer of the liver. Human papilloma virus, HP, can cause cancer of cervix. Human T-cell leukemia virus is responsible for T-cell leukemia. 6. Physical agents like sunlight, local heat and ionizing radiations are also causative factors for skin cancer, leukemia. 7. Many infections like schistosomiasis cause cancer of the urinary bladder. 8. Married women show higher incidence of cervix and breast cancer. 9. Certain drugs like butazolidine, estrogens, also lead to higher incidence of cancer. Thus, chronic irritation, friction or trauma, genetic factors are also important factors for certain cancers, e.g., retinoblastoma. Symptoms. 1. Any persistent lump. Though. Wound that does not heal. 3. Unusual weight loss. 4. Unusual bleeding from any part of the body. 5. Indigestion. 6. Difficulty in swallowing. 7. Hoarse voice and regular coughing. Prevention and control of cancer. Cancer can be controlled by primary prevention and by secondary prevention. Primary prevention. 8. Avoiding carcinogenic agents like alcohol and tobacco. Though. Control of air pollution. 3. Improvement in personal hygiene decreases cervix cancer. 4. Control of radiation exposure. 5. Immunication against hepatitis B virus. 6. Testing foods, drugs, cosmetics for their carcinogenic activity. 7. Health education to create awareness about cancer. 8. Early diagnosis, proper treatment, aftercare and rehabilitation. Treatment of cancer includes chemotherapy, e.g. busulfan, methotrexate, fluorouracil, vinca alkaloids etc. Radiotherapy and surgery. All these measures are used in combination for best results. No. Help of law to control known carcinogens. Thus, improving lifestyles, habits and diet. Secondary prevention includes a. Registration of cancer cases to hospital to assess the severity of the problem and for providing the necessary services. B. Developing proper screening programs for detecting cancer at pre-malignant stage. C. Providing medical facilities to all cancer patients. Coronary heart diseases. Various types of coronary heart diseases are 1. Angina pectoris. 2. Congestive heart failure. 3. Myocardial infarction. 4. Atherosclerosis. 5. Cardiac arrhythmias. 1. Angina pectoris. Angina attacks are due to the temporary ischemia, lack of oxygen, of the myocardium due to either atherosclerosis, hardening of arterial walls, or vasospasm. When the coronary blood flow is inadequate, the myocardium gets insufficient oxygen and nutrition, and also metabolites are not washed off from the heart muscle. Classical angina pectoris is characterized by sudden, severe, pressing chest pain which radiates to the left shoulder and along the flexor surface to the left arm. The attack may be very acute or it may be short-lived and may reoccur for years. Variant Prinzmetal's angina attacks are unpredictable and may occur at rest or in sleep. Though congestive heart failure. Congestive heart failure, CHF, occurs when the left, right or both ventricles fail to pump sufficient blood to meet the body's need. It is more commonly seen in males than in females. Various factors which lead to congestive heart failure are essential hypertension, coronary artery disease, rheumatic heart disease, pulmonary embolism, hyperthyroidism and persistent cardiac arrhythmias. Management of congestive heart failure includes correction of underlying disease states, e.g. hypertension, sodium-restricted diet, diuretics, cardiac glycosides, digoxin, digitoxin, deslanside, aubane, vasodilators, hydralazine, nitroprusside, nifedipine, prazosin, and bed rest. 3. Myocardial infarction. Myocardial infarction occurs due to acute obstruction of a coronary artery which results in occlusion of the blood flow to the dependent myocardial tissue. It is characterized by severe pain at the same sites as angina, breathlessness, vomiting, extreme tiredness and pallor. Pain may last longer than angina. Arrhythmias are the most frequent complication. 4. Atherosclerosis. Atherosclerosis is characterized by a thickening of the arterial wall with connective tissue and deposits of cholesterol. Deposition of fat and fibrous thickening results in narrowing of the vessels and increased resistance to blood flow. This leads to reduced supply of oxygen to the myocardium. This disease affects the coronary, cerebral, vertebral and renal arteries and may lead to coronary heart disease, cerebrovascular disease and peripheral vascular disease. 5. Cardiac arrhythmia. Arrhythmia is disturbed normal rhythm of the heart. It may be either due to a defect in the impulse generation, abnormal impulse formation, ectopic beats, or due to abnormal propagation of impulse, conduction defect. Depending upon the disorders of impulse generation, they are classified as a. Premature contraction occurring in atria or ventricle, ectopic. B. Paroxysmal supraventricular tachycardia. C. Atrial flutter. D. Atrial fibrillation. A. Ventricular tachycardia. F. Ventricular fibrillation. Hypertension. High blood pressure is usually referred to as hypertension. Generally, any blood pressure 140/90 mm of Hg and above is taken as high blood pressure. The diastolic pressure is the important index of hypertension. WHO has defined hypertension as a systolic blood pressure of 160 mmHg and above and or diastolic blood pressure of 95 mmHg or above. Mild hypertension 90-104 mmHg diastolic blood pressure. Moderate hypertension 105-114 mmHg diastolic blood pressure. Severe hypertension 115 mmHg diastolic pressure or greater. Types of hypertension. Clinically, hypertension is of two types: a. Primary or essential hypertension. The exact cause of hypertension is not known. B. Secondary hypertension. The causes of secondary hypertension are I. Renal disease, glomerulonephritis, pyelonephritis. E. Endocrine diseases e.g. pheochromocytoma, Cushing syndrome, aldosteronism. Thyrotoxicosis. E. Complications in pregnancy. Causes. 1. Hereditary and family history. 2. Obesity. 3. Increasing age. 4. Stress, strain, anxiety and tension. 5. Consumption of diet rich in fat, especially saturated fat. 6. High salt intake. 7. Alcohol and tobacco smoking. 8. Lack of physical exercise. No. Use of oral contraceptives. Prevention and control. Following measures can be taken. 1. Primary prevention. A. Weight reduction. B. Reduction in fat intake. C. Increase in consumption of vegetables, fruits, whole grains. D. Reduction in salt intake. A. Restriction of smoking. F. Reduced alcohol consumption. G. Reducing the stress and strain of life. H. Self-care by regular checkup. I. Health education and health promotion. Do. Secondary prevention. 1. Early detection and diagnosis. Do. Drug treatment should be instigated at diastolic blood pressure above 100 mmHg. Antihypertensive drugs like beta blockers, calcium channel blockers, ACE inhibitors, alpha blockers, vasodilators are used effectively. Diuretics are also the primary drugs in all types of hypertension and are widely used in combination with other antihypertensive agents. Examples of diuretics which are commonly used in hypertension are the thiazides, furosemide and potassium-sparing diuretics. By the use of antihypertensive agents, various complications like cerebral thrombosis, infarction can be prevented. The risk factor of cerebral stroke is 5 times more in hypertensives as compared to normotensives. Rheumatic heart disease, RHD. Rheumatic fever is the cause of rheumatic heart disease, which is caused by infection of throat by group of hemolytic streptococci. It is the disease of connective tissue, particularly heart and the joints, and is a common cause of premature deaths. It is characterized by fever, inflammation of joints, carditis, tremors, mitral stenosis. It may also affect aortic, pulmonary and tricuspid valves. Complications are congestive heart failure, subacute bacterial endocarditis and atrial fibrillation. Prevention and control. A. Early diagnosis and treatment of cases with streptococcal infection of throat by IM injection of penicillin containing 300,000 units of long-acting penicillin, procaine penicillin, benzathine penicillin. Do. Prevention of reoccurrence of rheumatic fever by giving injection of benzathine penicillin at intervals of 3 weeks for at least 5 years or until the child reaches 18 years of age. 3. Improvement of socio-economic conditions like standard of living, poverty etc. Diabetes mellitus. Diabetes is a syndrome in which the body fails to make proper use of sugar. The diabetic syndrome is due to a relative or absolute deficiency of insulin and is characterized by a rise in blood glucose level. The hyperglycemia causes glycosuria with a consequent osmotic diuresis, electrolyte and water depletion. There is also an increase in the mobilization of fat, which is in part metabolized to give excessive amount of acetoacetic acid and its derivatives in the blood, ketosis, and urine. The increase in gluconeogenesis causes a rise in urinary nitrogen and tissue wasting. Types of diabetes mellitus. A. Insulin-dependent diabetes mellitus, IDDM type 1. Do. Non-insulin dependent diabetes mellitus, NIDDM type 2. Type 1 diabetes is seen in young individuals of less than 30 years of age. It is the juvenile onset type diabetes. Type 2 diabetes is more common type of diabetes and occurs in middle-aged and elderly people and can be controlled by treatment or dietary control. It is adult or maturity onset type diabetes. Symptoms. A. Hyperglycemia, increased blood sugar level. Do. Glycosuria, sugar in urine. 3. Loss of weight. 4. Ketosis. 5. Acidosis. 6. Dry skin and mouth. 7. Dry tongue. 8. Polyphagia, increased appetite. 9. Polydipsia, increased thirst. 10. Increased rate of breathing. 11. Coma. It may lead to number of complications, e.g., cardiovascular, renal, neurological, ocular and other infections. Causes of diabetes. A. Decreased production or action of insulin hormone secreted by the beta cells of islet of Langerhans in the pancreas. Insulin deficiency may be due to pancreatic disease, defective formation of insulin, destruction of beta cells in the pancreas. 2. Heredity. 3. Diet rich in carbohydrates and fats. 4. Obesity. 5. Viral infections. 6. Certain chemical agents like alloxan. 7. Lack of exercise. 8. Stress, trauma, surgery, pregnancy. Prevention and control. 8. Dietary control. Calorie and sugar restricted diet. Diet should be rich in protein and fibers. Though. Maintaining ideal body weight and exercise. 3. By use of drugs, the use of insulin along with diet is crucial to the survival of type 8. Insulin-dependent diabetes. For the management of type 2 diabetes, diet, insulin, oral hypoglycemic agents, oral sulfonyl-ureas, tolbutamide, clopropamide, play a major role. The biguanides fenformin and metformin are used only for those rare type 2 diabetes who are allergic to sulfonylureas or cannot use insulin due to allergy and mental or physical disability or cannot be controlled on diet.